Hi everyone, I'm Dr. Hossam Elzeiny. I'm one of the subspecialists in infertility and reproductive endocrinology with Melbourne IVF. So quite often we see couples who are coming to see us for a second opinion, or they have failed treatment in some other centers and they are coming to see us to see what can be done next. So the first important advice that I'm telling couples who have failed treatment before is to take a deep breath and have a little break, okay? And after that, you choose the doctor who you want to deal with. You come with all of the relevant information, all of the previous cycles, all of the investigations that has been done, so we can start from here and we don't have to repeat any of the investigations or any of the treatments that has been done before. This is a very emotional time. So they come to see us, they have mixed feelings, frustration, and having lots of questions in their mind. And this is very important. And sometimes they have all these questions written in a paper, which is good, so we can go through them as we go. So the most important thing is to look at all the previous treatment that has been done, take a complete history, because from the history you can sometimes tell if there is something else that may need to be done other than the treatment that they have gone through. So this is very, very important. Another thing that the couples need to know is that also not every fine details I need to know about. There are certain things that are very essential when we are dealing with couples who would like to achieve the pregnancy. Most important questions, and maybe one of the very, very few things that's all that I need to know, is the age of the female partner. The age is the most important thing, okay? And to be honest, there is nothing that can reverse the age, okay? Obviously, we will look at the egg reserve test. We will look at the semen analysis. In most of the time, there is one step in the IVF that can overcome the severe forms of male infertility. There is a very low sperm count, motility, or shape. You are just selecting one sperm and inject it into the egg, and that's called the egg. See, that's usually sort out the problems of not having enough sperm. And then going through the cycle that has been done before, you will know where the problems has happened. The problem may be during the stimulation. We are not getting good quality eggs, or we are not getting the normal percentage of mature eggs. We may have problems with fertilization. Even sometimes after you do ICSI, which is expected to give us a good fertilization rate, some patients may not have fertilization at all, even after ICSI. And then we look at the development of the embryo in the lab. Are we getting the good quality embryo that can achieve the pregnancy that we are hoping for or not? And the percentage of those embryos compared to the number of eggs and the fertilized eggs that has been achieved. So all these things, so there are things that can go wrong during the cycle. So we go through that and then we say to our patients, okay, there may be a solution here. We can do that next time. But again, as I said, there are things that we can do, and we have witnessed over lots of years, lots of difficult patients that can achieve a pregnancy with this strategy. But there will be others that unfortunately things will not go well with them. And it's important here for the couple, this is very, very important advice, for them to limit the number of the treatments that they are going to have, especially when we are consistently not getting good results. You say, okay, I'm gonna do another 1 or 2 cycles and then I will stop. And then you have other options. We will be able to tell from the cycle if it's a sperm problem or egg problem or combined, and then we can hear do, sperm donation, egg donation, or embryo donation, and you still can achieve the pregnancy at the end. Most patients, even when they have a very small chance of getting pregnant, maybe due to age or something like that, they still want to go ahead and do the cycle because they don't want to feel like they have regretted later on that they haven't done that cycle. So by talking to your doctor and by limiting the number of cycles that you are going to have, that's probably will give you the best outcome at the end. And I wish for all the couples during this journey to achieve what they need. And if you like this video, like it and subscribe, and you will, so that you can get more videos from the Fertile Mind.